Hello, I'm Dr. Robert Carey, and I'm a urologic oncologist here at Sarasota Memorial Hospital, and one of my specialties is treating prostate cancer. And today we're going to talk some about what a robotic prostatectomy is. A prostatectomy is done for someone who has prostate cancer, but not just any prostate cancer, because many people have prostate cancer that doesn't need to be treated, and I can work with those patients in other ways. The prostatectomy is done for people who have life-threatening prostate cancer that's at risk to spread and could cause pain, suffering, and death. And for a prostatectomy, it is the ideal way of treating this cancer because it offers a chance at complete cure, where the prostate can be removed and the cancer is cured.
Thank you so much, Dr. Carey. What are the benefits of a minimally invasive approach?
The minimally invasive approach to doing prostate cancer has been in vogue really since about 2003. I was fortunate in that I have a PhD that allowed me to work with robotics in addition to my medical degree. And so, since 2003, we've been doing prostatectomies primarily in a minimally invasive way, meaning that instead of making a large incision and putting our hands in, we're going to use tiny incisions, about 8 millimeters each, and insert a robotic instrument. Even though the Da Vinci robot, which is to my right, is very large, the actual entry of the instruments into your body are very small. It is a very reliable robot, completely controlled at this console by the surgeon. And so when we're working inside your body, the camera gives us 10 times magnification, and the fitted instruments are going to give us sub-millimeter precision. So even though you have this big instrumentation, the actual things that enter the body are very small and allows us to do microscopic and precise dissection of your prostate. The prostate in a prostatectomy is completely removed, as are the lymph nodes, and this will afford the patient complete cure. The advantages for the patient typically are going to be that there is less pain, but more importantly, you have a better long-term outcome. Cancer cure, preservation of continence so the patient doesn't leak urine, and then preservation of potency, but emphasizing all of these for long-term outcome. Even so, while we emphasize long-term outcome, the patients will have this surgery and go home the next day. About 95 to 97% of the patients over the last 12 years of me doing robotic prostatectomies here have gone home the next day. The vast majority will have a catheter for about a week. Most of the men do not complain so much about pain. Some of them will have pain pills that they take, but the vast majority of the men, once they go home, will take just pain pills, just Tylenol.
Wonderful, thank you. And who is a good candidate for this minimally invasive prostatectomy?
That is a wonderful question, and that's why when people come to see me for a prostate cancer discussion, these discussions usually last for about an hour or so. We care about men primarily who are at risk to die of prostate cancer. Some men may have prostate cancer, and I will look at their cancer and tell them that it's safe to watch it. And that is I have over 400 men that I follow for what we call active surveillance. They don't need any treatment right now. On the other hand, there are 32,000 men each year in the United States who die of prostate cancer. These are the deaths that we want to prevent. And by performing a prostatectomy, these are the ones where we have saved lives. And so people who have high-grade, aggressive prostate cancer are excellent candidates. It doesn't matter if you're fat or if you're skinny. It doesn't matter if you're tall or short. It doesn't matter if you're old or young. It doesn't matter if you're going to have previous surgery or hernias or other things. The ideal candidate is someone who has high-grade, high-risk, significant prostate cancer that needs to be treated, and we're able to offer them a minimally invasive treatment where very quickly, very efficiently, their cancer gets cured.
Thank you very much. The Da Vinci surgical robot is what we use here at SMH. Can you show us a little bit how it works?
Absolutely. The surgeon will be sitting in this console, and so this is a 4-arm and leg robot, meaning that both feet of the surgeon are going to be working below, and both hands of the surgeon will be working in these consoles, and the surgeon will be looking in. The actual robot will be docked to the patient, and each one of these is an arm. You might say, why is the robot so big? And that's because it works with classic Newtonian physics, levers and pulleys, things that are absolutely reliable, and then you combine it with the complex electronic devices, and so that you have a very reliable robot that we can doctor the patient, complete your surgery. And it's important to realize over 3,000 robotic prostatectomies that I've done, we've never had to stop the case because the robot didn't work. The robot is very reliable. And so we don't have any of the robotic instruments that go through, but each one is about the size of a typical ink pen, and the tip of the ink pen is the size of the tips of the instruments that we use. And so you can imagine how we bring this up to the patient, and each one of these is spaced apart, but they're working inside the body in a way where nothing clashes.
Thank you so much for your time today, Dr. Kieran. We've learned so much.
Thank you.